I just lost my brother full on in a car accident, and I was looking for a home with other moms who would understand and would just pray for me. I didn't know anything about the group until Adrian Wagner told me that there's a group of moms who meet together and pray for the school, the teachers, and the boys once a week. And I thought that is great, and I want to be a part of that group. I was very brokenhearted that day when I call in. I didn't know how to just move on a day at a time because the pain was so bad. I needed to find a way to serve the community so that I can honor my brother.
Currently, I'm working full time in the COVID ICU. It's been almost 40 days away from my son. My wife and I see each other, socially distanced a couple of times a week, but I've not held my son in 40 days, and that's what makes this hard, especially with no end in sight.
I got to experience firsthand how lonely my patients can get during this time. And the healthcare workers need as much support as they can to fight this virus infection. The mom and prayers decided to bring in lunches for the nurses and the nursing staff, including physicians on the team. Uh, Twice a week, just bring them lunch. Simple as that. But that means so much for the nurses and the team there. And for the patients, we provided single-use items like puzzles and accompanying pencils and crayons.
And I think I was the charge nurse that day and was collecting things, and she mentioned it was from the St. Mark's Moms in Prayer group, I think. And I mentioned to her that I had attended St. Mark's in junior high.
We discovered that one of the ICU nurses is one of our own St. Mark's alumni. He was very proud to be a Lion. This particular nurse showed a lot of character, I have to say. He cares for his patients like his own family. He's a hero, being part of the frontline healthcare workers and fight for the patients.
The nature of any ICU on any given day, much less the environment that we're in now, just the ability to take a break, or just the ability to think ahead far enough to when you have time to order and take delivery and things like that, and doing that on an individual basis for a dozen individual nurses on any given day, like there's a real practical benefit to just having food materialize and everybody go to the trough and eat and then go back to work. So we're grateful. It reminds us of why we're there and what we're doing.
I am so proud that he came from St. Mark's and showed that kind of leadership character for other people.
It's good to know that while we're at work, there are people out there that are, have us in mind. Otherwise, we wouldn't know that.
God knows the needs of everyone and connect the dots so that the St. Mark's Mom and Prayer group could reach out and connect those dots for them. I am amazed how God works in this way.